Today, we are here in one of the major hospitals of Lucknow to introduce Dr. Vaibhav Khanna. I must tell you that before going to Dr. Vaibhav Khanna, he needs no introduction. He himself is an authority in one of the subject that is called plastic surgery. Plastic surgery is one of the major concept which results after an injury or a burn case or any other type of transplantation of skin and to give a more of a cosmetic effect to the body. He is specialized in that. I have today with me, on behalf of ICM, I am Gaurav Sinha, welcoming Dr. Vaibhav Khanna on this occasion. Dr. Vaibhav Khanna, you are most welcome to ICM.
Namaskar Gaurav. It's a really pleasure to meet you after a long time. I would like to congratulate the ICN and team for going to this subject.
Thank you, Doctor.
And to educate the masses
Right.
about the plastic surgery and the effect and what best we can give to society.
Right. So, in fact, if I have to ask you and go to the beginning of it, how this plastic surgery concept came into effect?
You know, plastic initially was people confused with the cosmetic surgery.
Right.
Plastic is not a cosmetic surgery.
Okay.
Cosmetic surgery is a small part of plastic surgery. I was really influenced by plastic surgery branch when I was doing my MS surgery.
Right.
And my mentor, Professor Ashok Gupta ji, came from, he is in Padam Shri. He came from Bombay and he showed me the replantations, cut fingers, cut
Right.
hands, that are revascularization, and they are working. So I was really impressed when I was doing house job. So I said, this is the only branch because the most other branches in our surgery, we are more going to remove the part.
Okay.
This is the only branch we are going for reconstruction of the part.
Right.
So the main aim is that we are doing a reconstructive part, the reformation part, and sometimes a cosmetic part.
Right.
So my mentor was R.P. Sai Sahab, who was head of department at that time.
Right.
He also encouraged me to go for plastic surgery. So my journey and the honors goes to him also. And ultimately Professor Ramesh Chandra Sahab, who was the head of department of plastic surgery,
Yeah.
and the other Professor A.K. Singh, Bhatnagar Sahab, Pandit,
Right.
they all helped me to go ahead and go for this branch. And when I was doing my MCS plastic surgery, I learned a lot in this branch.
Right.
Then I was doing chief surgery, and I was cleared, first time. No, I'm lucky
I know.
that I cleared the first time the entrance exam also, the exit exam also. Then when I was doing my chief residency, then Professor Bhatnagar, he gave me first microvascular case.
Musculoskeletal case.
A child came with injury, the vascular injury, and he said, go and do. And I was, the first case, I was really stressed and tense. The sir has given me this responsibility. But ultimately, we came out successfully, and the child was doing very well. So it gave me more encouragement and more enthusiasm. Now you can go ahead.
Yes.
And then Professor Ashok Gupta came for a conference, and he said he will join me in Bombay. He was at the topmost microvascular surgeon.
Yes.
So I left my chief residency a few months back, and before my completion of the term, and I joined that branch. And then I learned a lot about them. Then I went abroad also.
Right.
I went to different fellowships. Gradually I got improvement. I got a chance. Then, in the meantime, after 4 or 5 years of my practice, I got a chance to make at early age first hospital in Bareilly, Ramurthy,
Okay.
which is medical college.
Okay.
I was the founder director of that Ramurthy Medical College. So I stayed there for 3 years. And from there, I immediately went to Taiwan for my further fellowships. And I came to Lucknow. I started. Then Smile Train, Mr. Kalla approached me and he said, Dr. Khanna, like to start with this project.
Mm.
I've heard the name is Smile Train in Taiwan. They were doing a lot of cleft patients. So I have some idea of Smile Train, but that there was a, I think India, I mean, they've started around 2000 and we started around 2005.
Okay.
We started at Vivekananda Polyclinic, this project, and gradually got a full ward. They helped me a lot in building a department, in building a project, and the world-class equipment also. And the Smile Train, Mr. Kala was a very person, very noble person.
Very, very noble person.
And he helped me a lot. So gradually we built up, and today we have operated more than 20,000 patients.
Okay.
Totally free of cost. This project, Smile Train, gives totally free treatment to child born with a cleft lip and a cleft palate and a speech deformity. And their approach is a holistic treatment to provide the complete rehab of the child.
Right.
That is what the concept is. And there is not a single penny charged from the patient.
Right.
It's a great idea. Really thankful because it's a US-based project. But and now Renu Mehtaji and other people are there. Nanu Mamta Carrier is the chief now, who's replaced Mr. Karla Sahib. But under their leadership, this is going further and going, and they're more now for social cause also.
Right.
So it's a complete project. And when a child whose family is disturbed and came with a cleft patient,
Right.
and when you give a normal smile and normal speech, the satisfaction you get is not the money, no money can be.
Yeah, absolutely.
So with this approach, we go ahead
You start with
today, and then gradually we shift it here when you open this hospital also.
Right.
So we are going here.
So here also you are doing this in the city hospital. So doctor, I just wanted to know exactly what is the success rate in this type of palate operations or the cleft?
No, with so much experience and cutting good team also, now success almost 100%.
Almost.
It is not, it is, you know, smile in the Smile Train, the cleft patient, the problem is not a surgery.
Right.
The main challenge is optimum surgery.
Right.
And the best outcome. You're going to give a normal child face, a normal lip area, a normal nose, a normal palate, and normal speech.
Absolutely.
So challenge is not the closure. Closure anybody can do in a village also. You can put 2 stitches and close. People used to do it. It's a complete rehabilitation, a complete transformation of a child from a cleft face to a normal face.
Yes.
So totally transformed. This is what it is. Then obviously, then I also have a passion for microvascular surgery. So I learned this microvascular surgery, and now then I introduced. And I was initially it was not in Lucknow too much. Then we started microvascular surgery, and we made a center to do any child or any patient who is a trauma or a complete cut of the fingers or the hand or the limbs. We have seen even there was I think 3 or 4 years back. There was a young child, young doctor. He was studying in this middle college, and he got injured. His limb was totally severe, and we do the replantation at Vedanta, and 12 hours, and the child is doing almost normal. Right, he was doing a right upper limb, and he complete normal, and he was doing now he has completed his MBBS also.
Wow.
So when this type of achievement you get, then you get satisfaction.
Yes. Because I recall you named a few of the doctors, Dr. Shai, Dr. Ashok Chandaza, and so many people. At that time, the college, the KGMC itself, was coming up with these type of departments. And at that time, whatever was being taught there was so deep and so much advanced that today we are getting the benefit of it.
I think that this is the oldest department of plastic surgery.
Yeah.
So initially only 3 or 4 departments were there, and then the oldest department. Sharma at that time started department in KGMC. And then Professor Vaishnav sir further go ahead. And ultimately, you know, the environment, the culture.
That is more important.
So,
and selfless service, doctor, I would say.
So in that way, gradually it has grown up, and we are very thankful.
Yeah.
At times, our also, my godfathers also, they've helped me a lot.
Right. Sorry, one question is there now. Suppose, apart from this specialized smile trained. The type of burn cases or the type of grafting cases or type of a plastic surgery cases which you
You
get.
know, congenital is cleft,
Cleft.
most probably. Then other deformities. Then we have burns. When
Burns.
we have acute burns and the postburn deformities.
Right.
Acute burns we treat them in a burn unit.
Mm.
In deformities, we have to correct them from face to toe.
Ah.
This is a branch which covers from head to toe, from hair grafting to a nail bed.
To a nail.
So this is plastic surgery covers the entire body.
Correct.
When you're doing cosmetic surgery, same thing from hair grafting to facelift to ear to neck to breast to hips, everywhere.
Absolutely.
Then liposuction, then the tummy tucks. So they are all these are part of cosmetic surgery.
Right.
In cosmetic surgery, the commonest people are going for still is this rhinoplasty for nose to make a beautiful nose, and sometimes the breast surgeries for their deformities. In India, the calf and others are not very common.
Very common.
Then we go, a big branch is reconstructive surgery because of high velocity injuries.
Right.
That this is the biggest challenge. Now people are having a trauma, severe trauma, where the limb is injured, the fracture, but fracture is a small part. The soft tissue surgery
Soft
is
tissue
severe,
injury is severe.
then the vascular surgery injuries, and this is a big challenge. To
Right.
first save a limb. We today going to operate a patient. He was operated around 10 days back.
Right.
He was having a trauma with a vascular injury with severe compartment syndrome, so there was no vascularity. Immediately he was operated. Now we could save the limb.
Right.
So this is the what challenge.
But sir, one thing, these are few of the things which take place accidentally, burn case or some trauma or something of the sort. But there are certain issues which are being deliberately being given, like acid burn case. You know, how does this plastic surgery
I see
help?
words. You're very right. It reminds me of my first challenge. I was in Nova's hospital at that time, and
Okay.
a young lady, very, very beautiful. Because father was a GM in a State Bank, and it was a big case. And because of she was young, so there was some little problem, and that problem somebody threw acid.
Acid.
on
That's
her face,
the worst
and
thing.
her half face was burned, severely burned, and the whole family was exhausted. Whole family were traumatized. They were in tears. How to go ahead?
Right.
She said, "Sir, मुझे मेरा face," and with tears. And father also, same with the folded hands. Really challenging because normally we never go from microvascular reconstruction acute phase. We don't normally do treatment, we do correction, and then last after few months, when the thing is healed, then we go for it. But that will be a very bad phase.
Right.
God blessings. I went with a team, I went for microsurgery, and we tried to make a face, probably half of the face from the back. And luckily, it was successful. After that, she went for around 17 surgeries. Some here, some in Delhi, some in US, minor correction area for cosmetic. But today, she is in US, and she is doing now. But she is totally rehabilitated.
And she's very nice.
I said, but now with more education and more government sickness, and now acid burning
Things are reduced to a great extent, which was very
almost,
common.
now it is very uncommon. This is a good thing. Only thing is suicidal burn is also very rare. Very rare. Homicidal burn is also is more accidental burn.
Right.
The reason is, say, males are driving vehicles, so they have more accidental prone. See, the females are driving the kitchen,
Correct.
so they are more prone for that.
Correct.
So, what we said, the suicidal or homicidal is not there. It's a mainly accidental burns. So our society is not very bad,
Yeah, no.
and people are still they take care of the family members.
Right. In fact, Doctor, this is it's an ocean of knowledge, Dr. Vaibhav Khanna, we had a limited time to talk to him, to know so much, and there is still unlimited knowledge is available. Whenever we get time next, we will definitely be talking to him about more of plastic surgery.
I'm so thankful to team and you people. After a long time, I have met you also.
Sir,
Used to
it's
meet
my pleasure entirely, and
my
thank you
my
so
good
much.
wishes for
Thank
your,
you so much, sir.
maintain your health and everything.
Absolutely, and thank you so much for being with us in this evening, and looking forward to seeing you more and learn from you, and also a message to a society if you want to give in few words.
Biggest thing is always try to help the others.
Absolutely.
And if they are in need, whatever you can do, it may be a treatment
Part.
or other reasons. This is what we can do.
Thank you so much, sir. Have a wonderful day, and thank you once again.
It is a great pleasure.